What's going on?
Parasitic fungi can be harmful when they invade other organisms, including humans. But before they invade, they must meet three conditions. First, the presence of the host. Second, the ability to penetrate the host. And last, the ability to digest and absorb nutrients from host cells. Most fungi cause infections in living things by spreading spores into the air or water. When fungi enter cells, they break down the cell components and consume their nutrition until the cell dies. This process is continuously done to the other cells after each cell they invade is dead. Because fungi grow slowly, the diseases they cause are frequently chronic. The fungal disease in humans is called mycosis, which are usually caused by more than one organism. Mycosis can be classified as systemic mycosis, dimorphic systemic mycosis, cutaneous mycosis, subcutaneous mycosis, and superficial mycosis. These classifications are classified based on the level of penetration into the body tissue. However, some fungi can be opportunistic, which means they don't normally cause disease but can do so in people with weakened immune systems.
Mycosis can also be classified by the clinical nomenclatures, which are site of the infection, route of acquisition of the pathogen, and the type of virulence exhibited by the fungi. Classification of mycosis based on site, mycosis are classified as superficial, cutaneous, subcutaneous, and systemic or deep infection, depending on the type and degree of tissue involvement and the host response to the pathogen. Superficial mycosis are restricted to the stratum corneum and cause no irritation. Other than that, cutaneous infection involve the integument and its appendages, including hair and nails. These may cause inflammation on the skin. A variety of distinct illnesses known as subcutaneous mycosis are defined by an infection of the subcutaneous tissues, typically near the site of traumatic inoculation. Next, deep mycosis involve the lungs, abdominal, viscera, bones, and central nervous system. Moreover, when mycosis is classified according to the route of acquisition, a fungal infection may be either exogenous or endogenous in origin. If classified as exogenous, an infecting organism may be transmitted by airborne, cutaneous, or percutaneous route, while for endogenous, it acquired from colonization or reactivation of a fungus from a latent infection. Lastly, mycosis also can be classified based on virulence, primary pathogens, or opportunistic pathogens. A primary pathogen may establish infection in an immunologically normal host where is to establish infection. An opportunistic pathogen has to undermine the host defenses in some way.
The next part is about fungal infections in humans. The first is systemic mycosis, a fungal infection that affects internal organs. These fungi enter the body via the lungs, through the gut, paranasal sinuses, or skin. Patients who are immunocompromised are inclined to systemic mycosis infection. They can develop in healthy patients too. There are two varieties of systemic mycosis, which are endemic respiratory infection and opportunistic infections. The first is endemic respiratory infection. The fungi that cause this infection were found in soil and wood debris. This fungus can cause infection in people with normal immune function and immunocompromised people. It includes Histoplasma capsulatum, causing histoplasmosis, Coccidioides immitis, causing coccidioidomycosis, Blastomyces dermatitidis, causing blastomycosis, Paracoccidioides brasiliensis, causing paracoccidioidomycosis, and Thalaromyces marnefei, causing thalaromycosis. Next is opportunistic infections. The fungi that caused this infection was found in or on normal skin, a decaying vegetable matter, and bird dropping bulb. It includes Candida species, including non-albicans Candida, causing candidiasis, Aspergillosis species, causing aspergillosis, Cryptococcus, causing cryptococcosis, and Zygomycetes, causing zygomycosis. The disease that caused by systemic mycosis is Cryptococcus neoformans infection. This fungus lives in the environment throughout the world. This infection can infect people who breathe in the microscopic fungus, but most people didn't get sick from it. Usually it infects lungs, the central nervous system, which are brain and the spinal cord, but it also can affect other parts of the body. The symptom of the infection depends on the parts of the body that are affected. First, if the part of the body that are affected is in the lung, the symptoms are cough, shortness of breath, chest pain and fever, while in the brain the symptoms are headache, fever, neck pain, nausea and vomiting, sensitivity to light, and confusion or changes in behavior. The treatment for this infection is the patient need to take prescription of antifungal medication for at least 6 months or longer. The treatment also depends on the severity of the infection.
Dimorphic systemic pathogens are termed dimorphic because they can occur in two distinct forms. When cultured at a cooler temperature of 25 degrees Celsius, they will appear as filamentous molds as saprophytes. When they infect humans or grow at a warmer temperature of 37 degrees Celsius, they will appear as yeast with a unicellular morphology. Examples of dimorphic pathogens are Blastomyces dermatitis and Histoplasma capsulae. These mycosis can cause fatality, especially in people with weakened immune systems, such as those who have HIV or receive immunosuppressive medications. These pathogens are geographically limited as the lungs are typically the primary site of infection after inhaling Conidia. The mortality and morbidity brought on by these mycosis have quickly increased during the past few decades, particularly in nations where these fungal diseases are endemic. Systemic blastomycosis is an infection caused by the inhalation of Conidia of Blastomyces dermatitis. Blastomycosis is a chronic granulomatous and suppurative illness that typically starts in the lungs and spread to other parts of the body, primarily the skin and bones. The signs of systemic blastomycosis, which might include fever, coughing, sweats, muscle or joint pain, weight loss, and chest pain, are frequently the same as those of other lung infections. These signs typically show up between 3 weeks and 3 months after a person inhaled the fungal spores. Blastomycosis is not contagious since it cannot be transmitted from human to human or human to animal. The treatment for mild to moderate blastomycosis is the antifungal drug itraconazole. Amphotericin B is prescribed for severe blastomycosis. Histoplasmosis or Darling's disease is an infection caused by the inhalation of Conidia of Histoplasma capsulatum. The spores are common in the excretions of chickens, starlings, and bats. There are 3 forms of histoplasmosis in lung infection: acute pulmonary, chronic pulmonary, or disseminated histoplasmosis. According to Rivamka, patients with acute pulmonary will develop symptoms of fever, cough, nausea, chest discomfort, malaise, and sometimes acute pneumonia. Chronic pulmonary are pulmonary lesions that are usually apical and mimic cavitary tuberculosis. The symptoms include severe cough and dyspnea that finally escalate to incapacitating respiratory dysfunction. Lastly, disseminated histoplasmosis commonly affects infants and those with compromised immune system. Affect almost every organ in the body, including the adrenal glands, liver, skin, mouth, and central nervous system. Histoplasmosis is usually treated with antifungal itraconazole if the illness is mild to moderate. However, amphotericin B is prescribed for severe histoplasmosis.
Cutaneous mycosis, also known as dermatomycosis, are typical fungal diseases that affect the skin, hair, and nails in both people and animals. This disease can be caused by both yeast and fungi or is called dermatophytes. Dermatophytosis, commonly known as ringworm or tinea, is caused by fungus that has the ability to secrete the enzyme keratinase, which is employed by the fungus to utilize keratin as a supply of nutrition. Examples of dermatophytes include Tinea corporis and Tinea pedis. Tinea corporis, a circular rash that looks like a ringworm, may be caused by Trichophyton rubrum after having contact with contaminated soil or animal host. Another example, Tinea pedis, also known as athlete's foot, is transmitted by contaminated rags or flowers. It is caused by Trichophyton rubrum, Trichophyton interdigital, and Epidermophyton floccus. They make the toe look dry and peeling, and it has cracks between the toes. Even though it is an infection, But the unique thing of this dermatophytosis is that it does not invade the living tissues. Additionally, dermatophytes are the only fungus that has evolved a reliance on animal or human infection in order to persist and spread their species. Another cutaneous mycosis caused by yeast that usually comes from the genera Candida is candidiasis. Candida albicans usually cause candidiasis of the skin and mucous membranes, generally known as thrush. It frequently affects newborns and the elderly and may happen because of the weakened epithelial barrier function. One type of cutaneous candidiasis called intertrigo typically develops where skin folds rub against one another, like in the armpit or under the breast. An itchy crimson rash results from the heat and moisture. Baby that wears diapers also tends to get intertrigo on their buttocks because of the sweat of wearing diapers.
Now, I will discuss about subcutaneous mycosis. Subcutaneous often refers to an area beneath the skin. Chronic fungal infections of the skin and subcutaneous tissues, known as subcutaneous mycosis, are brought on by a variety of fungi and typically develop after harm to vegetative matter. It was also brought on by a large and wide array of microorganisms that implant themselves or are somehow introduced into the dermis or subcutis to produce sickness. As the ghostal agent endures and adjusts to unfavorable environment of host tissue, infection does progress slowly. Next, we will discuss about a few examples of subcutaneous mycosis. Basidioboliss ranarum is the fungus that causes the disease basidiobolomycosis. It could show up as one or more hard, painless nodules that turn purplish and have an itch that seems to be slowly spreading outward. A serious but less frequent form, which typically manifests abdominal soreness, fever, and alarm, affects the stomach and intestine. P. ranarum has been isolated from insect, reptiles, amphibian, and also mammals. It can also be found in soil and decomposing rocks. The condition is brought on by the fungus' direct penetration into broken skin, such as that caused by an insect bite or other trauma, or also by consuming tainted food. Next, we have chromoblastomycosis, often known as chromomycosis. It's a chronic fungal infection of the skin and subcutaneous tissue that can be brought on by a variety of pigmented fungus that are typically found in soil and wood, such as species from the genera Fungi, Cladophyalophora, and also Phyalophora. While chromoblastomycosis can be found anywhere, it is most common in the tropics of the Americas, Africa, and Asia. Australia and Japan both frequently report on it as well. In rural areas, male farm laborers account for a large number of cases. Next, we have mycetoma. It is a condition brought on by a specific bacteria and fungus that can be found in soil and water. Examples of bacteria or fungi are actinomycetoma and eumycetoma. These germs and fungi can enter the body through a skin ridge, frequently on the foot. Firm, mostly painless, but crippling lumps appear under the skin as a result of the infection, which may eventually harm the bone beneath the skin. The number of people with mycetoma worldwide is not known, but there were 17,607 cases reported in a 2017 review of scientific articles between 1950 and 2017.
Okay, next I want to talk about superficial mycosis. Superficial mycosis are infection of the skin, hair, and nails caused by fungi that infect just the stratum corneum and the superficial layers of the skin. This skin condition is caused by parasite fungi on the epidermis of skin appendage, including hair and nails. The patient experiences severe itching, particularly at night, due to the condition. In addition, if not adequately treated, the fungus can spread throughout the entire body, and the disease is simple to recur, diminishing quality of life. Any age might have superficial fungal infections. However, the condition is prevalent among young adults between the age of 20 and 29, particularly students and students. Poor living conditions, living in groups, sharing clothing, or hot and humid climate, excessive perspiration, and etc. provide the condition for fungi to develop, spread, and cause disease. The accurate diagnosis of superficial fungal illness needs scraping the scabs of the affected area and then searching for fungi and bacteria. Fungal infection in the superficial layers of the skin hair and nails cause both superficial and cutaneous mycoses. The primary distinction between the two is that superficial mycoses typically produce little or no inflammation, whereas cutaneous mycoses typically induce redness and itching of the skin as a result of an inflammatory reaction.
Opportunistic mycoses are caused by fungi that are non-pathogenic in the immunocompetent host, but it can be harmful in the individual that has weakened defenses. Some people are born with a weakened immune system. Others may have an illness that attacks the immune system, such as HIV. Some medicines like corticosteroids or cancer chemotherapy can also lower the body's ability to fight infections. If you have a weakened immune system, you should be aware that fungal infections can happen. Learning about fungal infections can help you and your doctor to recognize them early. This may help prevent serious complications. There are a few examples of opportunistic mycosis infection, which are candidiasis, aspergillosis, and zygomycosis. Candidiasis is a fungal infection caused by a yeast called Candida. Candidemia is one of the most common bloodstream infections in the United States. During 2013 to 2017, the average incidence was approximately 9 per 100,000 people. However, this number varies substantially by geographic location and patient population. Next, aspergillosis is an infection caused by Aspergillus, a common mold that lives indoors and outdoors. Most people breathe in Aspergillus spores every day without getting sick. Aspergillus fumigatus is the most common cause of human Aspergillus infections. Other than that, mucormycosis, previously called zygomycosis, is a serious but rare fungal infection caused by a group of mold called mucormycetes. A review of published mucormycosis kits found an overall all-cause mortality rate of 54%.
Invasive fungal infections can be very harmful to individuals with weakened immune systems. Some of them are contagious while some of them are not. Therefore, people must be aware and take preventive steps to avoid these infections. Few ways to prevent fungal infection are covering up wounds and using air filters at home. Moreover, those with weakened immune systems must also avoid activities that involve dirt and dust. For example, gardening, yard work, and digging. They are advised to wear an N95 respirator to prevent inhalation of the fungi spores. In the medical field, fungi aid in the production of antibiotics. However, some species of fungi may cause diseases in humans. Hence, we must say that fungi are remarkable and unique because they can assist humans greatly and cause infections.
Time is Crager.